I know I've worked at facilities and they'll say, oh, this patient is VIP. Well, don't give them to me because all of my patients are VIP. Sending love, health, happiness, and prosperity to you watching this video. Welcome or welcome back to my channel. I'm Dr. Aisha, a family nurse practitioner, and in today's video, I'm going to be giving you the traits of a good nurse. The first trait of a good nurse is someone who is safe. I will always tell my orientees, don't worry about being fast. You worry about being safe, because when you're fast, that's when you make careless errors, and errors can mean life or death in a patient's life. So someone who's safe, someone who always asks questions when they're unsure. I was a bedside nurse for 6 years, and there were still things that I would ask about. I'm like, hey, have you ever given this medicine? Oh, I've never given this. Or if I didn't know what a medicine was, I would look it up, and asking fellow nurses, nurse managers about what to do with this situation. I would even ask the provider, hey, can you educate me on the reason why the patient is getting this? Because if I didn't see it in their notes, then I wouldn't, and if it didn't match the presentation or what was going on with the patient, I didn't necessarily feel comfortable giving something. And I wasn't the type of nurse who's just going to give something because it's an order, right? Because providers, physicians, PAs, nurse practitioners, they make mistakes too, right? So always ask questions, and I think that that's the number one priority, or that's the number one thing in being a good nurse. Man, so a good nurse is non-judgmental, right? They keep an open mind. Mind you, we are taking care of all different types of people from all different types of cultural backgrounds, religious backgrounds, skin colors, because I believe there's only one race, the human race. And so people, if you are judgmental, or if you don't like someone because they have a different view than you, or they have a different belief or whatever it may be than you, that doesn't mean that you give them subpar care because you disagree with them. Your care should be safe across the board. You should not judge people. Keep an open mind. You're able to learn about different people, learn about different types of cultures. A lot of the times you're going to be taking care of people who are of a different socioeconomic status or class than you. So they may not have a lot of money. They may be uninsured. Just because someone doesn't have money or because they're uninsured, that doesn't mean that they get subpar care either. Your care should be, I think, equivalent across the board, no matter how much money someone has. I know I've worked at facilities and they'll say, oh, this patient is VIP. Well, don't give them to me because all of my patients are VIP. Like, I just don't think that that's fair, and I don't think that that's right. As long as your patient is not disrespecting you, trying to abuse you or anything, give them good care and remain non-judgmental in the care that you give. Attention to detail. Attention to detail is what makes a good nurse, because if you're on the floor, like if you med-surg or ICU, although I never worked ICU, but if you're on the floor, noticing little subtle hints in your patient and bringing that to the provider, to the doctor's attention, that could be life or death for a patient. If you notice something, like the doctors, they come in and they're with the patient for a minute, maybe two. And so the patient, you're with them majority of the time, you are able to pick up on little things, and you can bring that to their doctor's attention and maybe have them order another test, whether it be lab test or whether it may be an image, something that they could potentially pick up on and, essentially save that patient's life. So I think paying close attention to detail is essential in being a good nurse. Man, a good communicator. This is up there with safety, right? This is like right next to safety, because as a nurse, you have to be a good communicator. You have to communicate with people, especially if you're a bedside nurse, right? And really, there's so many different areas of nursing that you can work. Even if you're working in case management, if you're working in infectious disease, if you're working in, I don't know, OR, wherever, you have to be a good communicator. You are that patient's manager. So when I was on the floor working transplant med surg, I would get so many calls, and I hated that phone. Lord knows I hated that phone because everybody's calling the nurse, and the nurse can't say, oh, that's not my job. Literally, everybody else can say, oh, that's not my job, ask the nurse. Everybody says, ask the nurse, ask the nurse, ask the nurse, ask the nurse. The nurse gets asked everything. So, like, you have to be a good communicator. You are going to have to communicate, with doctors, with other providers like PAs, nurse practitioners. You're going to have to communicate with the dietary people, like the people that are bringing them trays, physical therapy, occupational therapy, respiratory therapy, other nurses who you may be calling and giving report. So to the OR, to IR, to dialysis, to a skilled nursing facility or a nursing home, wherever they may be getting transferred. Let me see who else. Man, your CNA. Like, your CNA is your right-hand man when you are a bedside nurse on the floor, right? Because you may have 5 or even 6 patients or more, depending on where you live. I had 6 patients. No, I have 6. I don't think I've had 6 patients. I would have like 5 patients as my max. Having a good CNA that's like your best friend on the floor for that shift, because having a good one, they're gonna make your life easier. You may have just left out of a patient's room, medicating them, make sure they were good, and then 5 minutes later they calling while you in another room doing their meds or doing whatever, and they calling saying, I need to go to the bathroom. So you'll call your CNA up, hey, can you take 34 to the bathroom? Okay? So being a good communicator is key in being a good nurse. You have to know how to communicate efficiently and effectively so that people know what you're talking about and what you need to do to take care of your patient. Also, in addition to, this goes right along with being a good communicator. I talked about the nurse being a patient manager. But a good nurse keeps their patient in the loop. Like, you're not going to leave your patient out the loop. Patients are there to receive care, right? And so things change. The doctor is not going to tell the patient every little thing. They're going to tell you, the nurse, things. So you have to wait until you get a good amount of information and then go and update your patient on their care. It is their care, right? So you need to keep them in the loop on what's going on with their care. Like, I hate it when patients don't be knowing what's going on. We would have to do that as part of our rounds, and that was one of the things that they wanted to implement when we did bedside shift report, to ask the patient, do you know what's going on with your care? And then when I was pregnant and I was doing like the leadership rounds, I would ask, are the nurses keep you up to loop on your care? Most of the time they would say yes. Sometimes they would say no. I hate when patients don't know what's going on with their care. Not because they didn't listen, because ain't nobody told them. Like, if you want to be a good nurse, keep your patient or, their family member who's at bedside, or even if their family member is not at bedside, like if their family member is at work, because, a lot of people, they still go to work. You know what I'm saying? Like, whenever they call, because a lot of times I wouldn't necessarily have time to call them, but whenever they would call me, I would sit down and make time to talk to them. And they greatly appreciated that, because they cannot be in the hospital with their loved one for days or weeks on end. So they're relying on the nurse to give them an update on what's going on with their loved one. So keeping the patient and family member in on the loop on what's going on, it is a part of being a good communicator and makes you a good nurse. Being organized. Man, I can't stress this enough. Being organized, it is so key. Like, it is so key. Now, I initially was an ER nurse, so I didn't have to necessarily get to work early to read up on my patients, because it's just kind of in and out, kind of quick report. But when I got to the floor and I was doing transplant med-surg, the first job I got, I didn't get to work early. And I was always wondering, like, dang, why they here early? You know what I'm saying? They ain't clocked in yet. Why they here early? But then when I got to my other, transfer, or I got another job doing the same thing, transplant med-surg, and I had to do like my little orientation shifts, and one of the nurses was like, yeah, you know, most of the nurses get here early, like 30 minutes early, and, you know, they read up on their patients. I was like, oh, okay. And so it kind of made sense. So that goes right along with being organized, because if you get there early, you can read up on your patients. You already know their labs. You can look at the last notes, whatever the notes, you know, nursing notes, doctor notes, PT, OT notes, to know kind of the patient, what's going on with them. That way, when you hit the floor, you don't have to rely on everything the other nurse is telling you. Sometimes them shits be so busy, the other nurse don't even know what's going on with the patient. I'm just being real. They be like, oh, girl, I don't even know what's going on. I haven't had time to chart. I haven't had any time to look at any notes. So, man, and so that is going to help you be organized, because that's going to help you determine which patients are your sickest and which patients you need to go see first and medicate first, right? So, man, being organized, getting to work early, a little bit earlier, reading up on your patients, you can hit the ground running. You don't have to rely on what somebody else done told you. You'll be a good nurse. Willingness to learn. So, this is so key. You know, I would always just tell my nursing students, or, you know, new grad nurses, this goes kind of back with being safe and asking questions. Always be willing to learn. The patient, or the nurse who thinks they know everything, that's a nurse you want to run away from, because they are essentially unsafe. Things in healthcare always change. You just have to be willing to learn. There's so much to learn about the human body, about all these different medications, and nobody knows everything. The only one who knows everything is God. I think it's called omnipotent. Is it omnipotent? Whatever the term is, he the only one who knows everything, okay? Doctors are very smart. They went to school for a very long time. You know, they went through residency, they've studied, but they don't know everything, right? And so a good nurse is always willing to learn. And so the way I always will pose questions, and I still pose questions now because I'm a new nurse practitioner, and I work with resident physicians, and then I work with attending physicians as well. And I would always say, hey, can you educate me on this, instead of asking them why, right? So, like, being willing to learn is going to take you far. It's going to help you grow as a nurse, and essentially going to help you take better care of your patients. Being assertive. Knowing when to be firm and assertive makes you a good nurse, right? I remember when I was in the ER one time, and I was kind of a newer nurse. Maybe like 2 years of experience. But I didn't have experience in the critical care area initially, the way that my hospital was set up. So one day I was in a code and I was charting, and the one of the doctors was like, oh, can I jump on a computer? And I let him jump on a computer. And so another nurse, she was a senior nurse with more years of experience than me, she like got on my case. She was like, this was after the fact. And I think during that, like right after he asked me to get on the computer and I let him, she was like, well, you just lost your only recorder because you want to get on the computer. So after the fact, she told me, she was like, when you are, what'd she say? She was like, when you are taking time and you're charting in a code, you don't let the doctor tell you to get off the computer. That is your code. That is your room. You don't let him do that. Like, no. She like really got on my case. So knowing when to be firm. Also, like knowing when to say no in that case to that doctor, or even with patients, like if they are not confused, if they're in their right mind, and they are refusing to take a medication like transplant meds. No, like you need to take this. If you don't want to take it, then your body's gonna reject this organ. And I would just be like really firm with them, like, no, you need to take this medication. And then of course if they kept refusing, then I would chart it and then let the provider know. But like knowing when to be firm with whoever, it don't matter whether it's a doctor, whether it's another provider, whether it's another nurse, whether it's whoever. Knowing when to be firm is gonna make you a good nurse. Being your patient's advocate. Knowing, and not only knowing, but speaking up for your patient when they can't necessarily speak up for themselves, or when they don't know what's best for themselves. Good nurses do that. I think a good nurse is empathetic, right? Someone who can really put themselves in a patient's shoes and kind of sense how they feel. I think that makes a good nurse. Being empathetic and just, being caring. I think you have to be the most compassionate person, but treating your patients with some sort of compassion, you treat them how you want yourself or your loved one treated, right? I think that makes you a good nurse. Being genuine, and patients and their family members, they can always kind of tell. Professionalism. Being professional, I think, makes someone a good nurse because they're not out on their phones when they're taking care of their patient. They're not breaking HIPAA, right? They're not taking pictures of patients' foreign objects inside of their bodies and posting them on social media. They are keeping it professional, right? If a patient hits on them, sir, you will not talk to me that way. I'm here to take care of you. Do not be inappropriate type stuff, right? Someone who is professional yet friendly makes a good nurse. And the last thing that I think makes a good nurse is someone who smiles, right? You don't want to be taken care of by nobody who got an attitude or who always mad and don't smile. I would always smile. You know what I'm saying? Even pre-COVID, even during COVID, when everybody had to wear masks, you could always tell when somebody's smiling because you can see this. Yeah, you can see that. Somebody who smiles, a nurse who smiles, a nurse who is gonna help make the patient smile, and kind of take the patient off of the reason why they're in the hospital or the clinic or why they're sick. Like I would always ask the patient, I would always try to ask them something else other than their illness. Like, oh, you from here? Or, oh, what you watching? Oh, just try to find something so where you can kind of have a little bit of a conversation. Or if their spouse was in the room, say, oh, how long have y'all been married? I would just always try to find something to where we weren't always talking about their illness. And I feel like the patients really appreciate that. So somebody who smiles, I think that makes a good nurse because I think that is, that's going to make a difference, especially if the patient is not disrespectful but if they just kind of mad and angry because of their situation, because of what they have going on. They may not say that they appreciate your smile, but trust me, they do. They're going to appreciate your smile. So, those are what I think the traits are of being a good nurse. Did I miss anything? What would you add? What is something that you do that makes you a good nurse? Or what else would you add to this list? I hope this video helped you. If it did, please share. Be sure you subscribe. And thank you for watching. Until next time, be blessed and take care.